It's the Slam Dunk.
Okay, this government says health funding must be on the basis of need and not race. And on the surface, that's totally correct, except when you see the need, it's all along racial lines. It's hard to escape the fact. Okay, and the facts as they're laid out today make for confronting reading. They really do. This is the 4th annual Cure Kids report into the state of health in New Zealand today, and it paints a really alarming picture of how well our kids are doing. And it's a story of the haves and have-nots. And the wealthy and the healthy white kids across that side of town are fine. And the Māori and Pasifika kids across the other side of town, it is that stark and that worrying that we've got some real work to do. Despite record amounts of money going into health and child health, inequities persist amid high disease rates. In short, for some, it's getting way worse. This report details the alarming reality that for Māori and Pasifika children and for children living in areas with the greatest socio-economic deprivation, they have the worst outcomes by a long way, with the leading issues being respiratory conditions, rheumatic fever, rheumatic heart disease, skin infections, dental disease and mental health issues. Factors such as child poverty, limited access to healthcare and poor housing lead to all these bad results. It's particularly evident in the cases of acute rheumatic fever, where Pasifika children, get this, if you hear nothing from me today, just hear this. Pasifika children are 115 times more likely, and Māori children 46 times more likely to be hospitalised with acute rheumatic fever compared to Pākehā New Zealanders. How's that? 115 times more chance that they'll get sick. That is surely not acceptable to anyone, and we need a national plan to attack these worsting stats, because these stats are children, they're not numbers. Okay, and in mental health, social media has reared its ugly head, and here's the proof that we need to show how toxic it's been. There's been a 300% increase in our kids being hospitalised for their mental health and having suicidal thoughts. Let me just stop there. A 300% increase in our young people being hospitalised because of mental health. 300% in just 10 years. It's not good, and it's not good enough, and what we need to do is it's further proof that we need to show and be able to have the ability to say that our kids can no longer cope with the pressures of what society presents them. Then we have to act on that, don't we? To do nothing is negligent. Okay, and we have now had our warning. Social media is toxic. We know this. We know that all the kids are on it, but look what it's doing to them. We don't need further proof. We've got it right now, okay? Social media is toxic to young minds who can't always cope. And the adults in positions of power who can act now should, okay? That's all I've pretty much got to say on that matter.
Duncan Garner.